How do you know if you have frozen shoulder? Because if you have found this video, you are suspicious you have frozen shoulder. And let me tell you, as a physical therapist who takes care of women, these are some things you should think about. Is the pain, number one, so severe that it is some of the worst pain you've experienced in your life, and it is strangely, exquisitely strong? Number two, did it seemingly come out of nowhere? You don't seem to have a real mechanism of injury, like a fall or something that happened. You just woke up one morning and poof, it was there. Number three, are you a person who has some kind of hormonal compromise perhaps? Are you in your 40s or 50s? Do you have a vagina? Do you have possible a thyroid dysfunction? Do you have possible resistance? Are you possibly perimenopause? Are you all three? Because if your connective tissue knows that all these hormones are out of sorts, it's crazy, because the connective tissue in your shoulder, the myofibroblasts that shrink down, for some odd reason, pick the coracohumeral ligament on the anterior front part of your shoulder. This coracohumeral ligament goes over the long head of your bicep. So with this comes a certain set of symptoms that can look like bicep issues, that can look like rotator cuff issues. So with that being said, there are two types of frozen shoulder. Primary and secondary frozen shoulder happens if, say, you broke your arm or you had surgery and you were casted and you were immobilized and all the adhesive and cross-linkings and all the healing scarred down too hard and too much. But we have a mechanism of injury of why it happened. That's adhesive capsulitis. It's a shrunk down capsule. It's just tightening. But it doesn't necessarily have that chemical component that primary frozen shoulder has, that a majority of the frozen shoulders, I think, are, especially in the perimenopause, menopause community. Frozen shoulder is the pits. And I am telling you this because, believe it or not, your primary care provider, your MD, shown in research to be a great ally in this regards, because I need you to tell them, I'm having this terrible shoulder pain. Do you think it's frozen shoulder? Are you perimenopause? How's your thyroid? What's your blood sugar like? Your doctor can run tests to help determine what's going on with these things. Then if your doctor lifts up your arm and notices, holy crap, your range of motion, which is the ability to move, is super restricted. It's almost like there is a check rein when you go to move the arm into external rotation. So you can move your arm better than we can move your arm. This is kind of one of the telltale signs of frozen shoulder. When you go to lift it, it's like this. And women will tell me, I can't do my hair, I can't wash my hair, I can't shave my armpits, I can't put deodorant on. Frozen shoulder. Now, if they're not sure if it's frozen shoulder, your primary care doc can send you to a PT or an orthopedic doc. They can run diagnostic testing, all that stuff. But figuring out your hormones, if it's frozen shoulder, and then the primary care doc might be like, you know what? We're gonna knock this inflammation of your frozen shoulder right out. We're gonna do a steroid pack. We're gonna do a steroid injection in the shoulder. Guys, glory came down. Now I'm a physical therapist, and I'm telling you, going to the doctor is a very big deal for this. You really have to include your doc. Now I'm with you, lovingly checking your range of motion, helping you change your habits, helping you get through. But once the inflammatory process starts, we've got to stop it. And remember, as your estrogen declines, your inflammation goes up. This is why part of the reason you're kind of a prime candidate for frozen shoulder in the menopause transition. Love you, bye.